and welcome everybody. This is session 5, series 3. I can hardly believe it. February the 3rd, 2021, and welcome to this episode of the Maternity and Midwifery Hour. Really pleased to be with you this evening. My name's Sue Macdonald, and I'm the lucky curator of these hours and of the maternity festivals. And if you haven't booked for next week, so there's a maternity and midwifery festival next week on Tuesday. And as many of you will know, these sessions were designed around the time of the pandemic began to give midwives, student midwives, people in maternity care, and that it does include doctors actually, and people who are just interested in maternity services, some continuing professional development, and also access to information that they needed in their lives and in their jobs. And it's also, this is run by Matflix, who look after the whole system. And if you need any continuing professional development, any updating for your revalidation, or if you're doing a project, or if you're doing an assignment or an assessment in university or college, this is the place to go for some information, because we've got loads of information to get at. So do keep a look at the Matflix site if you can. Now, this evening we're going to be delving into vaccination, and obviously it's into COVID-19 vaccination. And I'm delighted I'm joined this evening by Dr. Ken Hodson, consultant in obstetrics and maternal medicine at the Royal Victoria Infirmary, Newcastle. I want to say Newcastle. Get a little bit of a thing there. And Linda Machakaire, who's head of midwifery at University Hospital Lewisham and co-chair of South East London Local Maternity System. And I'm going to start, as I always do, with a little moment of the week from each of my lovely speakers. So if I could start with perhaps Linda, if you'd like to share something from this week.
I guess I'll have to share that in all of what we've gone through in the past year, we've talked a lot about mindfulness and people accessing the right kind of support, especially around self-care. But as a leader, what I had done is neglected myself. And I run a lot. I run to get the endorphins out and so on. And I had just stopped. So I've put all my kit out and I'm starting again in a couple of days. So to me, that's a big thing, because that's my outlet. So my running feet are back, let's say it that way.
Well done. I can't imagine you not running about, Linda, or dancing. And those of you, if you follow Linda on Twitter, you'll see she has a little dance with her colleagues in the maternity unit, which is fabulous. That's super. Thank you so much. How about Ken? Do you have a moment that you can share with us, Ken?
Yeah, so I think my moment this week is to find someone to mend my old coffee machine, which I absolutely love, and was given to me as a wedding gift approximately 15 years ago now. So I'm delighted to have found someone, even in the pandemic, who can mend it for me.
Oh, wow. And in that, we've got even a sort of ecological message that you don't just chuck away a beloved machine.
Yeah.
Fabulous. Fabulous. Thank you so much. That's great. Well, we're going to hear more from Ken and Linda in a moment. But usually the process is that at this point, I just want to say, well, it's hard at the moment because we're still in lockdown and the statistics and the images on TV are still pretty grim. We've certainly gone over the 100,000 people we've lost to COVID, and many of you will know people who are either sick or who've died with COVID, and we really want to say we're so sorry and we're with you in feeling, and we send our love and good thoughts to you. It's really a very, very hard time for a lot of people. And of course, the NHS is under a huge amount of stress and pressure. And that, you know, we're losing healthcare workers as well, and that's awful. And this week we lost Sir Tom Moore, Captain Tom, as everyone will know him by. Even though he was 100, you kind of wanted and thought he'd carry on forever and do another bit of walking up and down the garden and raise another 30-odd million pounds for the NHS charities. A fantastic man and a sad loss. And I think probably it reminds us all of what's happening in the rest of the country, and in fact in the rest of the world, and it's a very difficult. So we're sending love and condolences to families and to friends of all the other people who've died too soon, and we're all in their way cherished and loved and will be missed, and we mustn't ever forget those people. It's a lot of people to be losing, and it's a hard time for all of us to work through. And we need also to support our colleagues and our staff in the NHS, because the trauma for them is going to be very intense, and it's going to go on for a long time because of the things they're doing and the care they're giving. They're giving their all to people, and that's really hard for people to cope with. So big thank you to our A&E departments, our intensive care units, our high dependency care units, and our love and good wishes to our NHS staff and the patients, obviously. And I always do a little thank you and a big virtual hug to my maternity care service workers from the whole team, because it is a very close team. And I think what we've seen over this year is the way that the team has gone very close together. The many of the speakers have talked about feeling like a great big family working together to look after women, their babies and families. And so a special thanks to them as well. And also, I'm adding to these thanks a special thank you to people who are doing the vaccination centres, and that's in primary care as well, in the GP surgeries. And thank you to them, because all the reports are coming back of how positive that is. 10 million people, over 10 million people have had their vaccinations, and that's a glimmer of hope for all of us for the future. And I know it's a lot of work, and I know that Linda has been doing some vaccinations for us as well. And so big thank you to all our people doing that. And a big thank you to all the key workers, and that goes for all the key workers who just keep us safe, who keep everything going the way it needs to be going. So thank you to them, and that's really sincere and heartfelt. So we've hit the 10 million vaccinations, which seems incredible. So on the other news, we have the news that Professor Jane Sandell, who will be known to many of you who are listening, has been appointed as the inaugural head of midwifery research at NHS England. And that's really fantastic for midwifery and midwifery research, and really good appointment. So congratulations to Professor Jane, that's fantastic. There's lots of new publications. There's the Lancet series on women and children's health in conflict settings, really important reading for us. There's also a new RCM podcast series coming out, so that'll be very useful for you, for people who are maybe on the move, maybe in the car, maybe running about. Linda, you'll be able to listen to your podcast, so that's fantastic. Other things that are going on this week and month: it's LGBT History Month this month. It's also a more depressing thing is Sexual Abuse and Sexual Violence Awareness Week this week. So there's been a lot on news, and there's a lot of links to be able to learn more about that online. A little bit not frivolous, but I think important, but not quite on the health aspect, is it's also National Storytelling Week. So those of you with children will probably know all about that already. And also, I just thought I'd raise the Zoe COVID-19 symptoms study. Many of you will be on this program. You can download it onto your phone, and you just go in every day to say if you've had COVID, if you've got symptoms, if you've had the vaccination, if you've got symptoms, how you're feeling. And they're tracking all that information. It's very much sort of research on the move, and it's really interesting because they're also providing some really interesting webinars, and you can get lots of information about what is really happening at the moment and what's happening in the world of vaccinations also. That all of that information is on, as always, and I'll hold it up, the information page, which is available on the Facebook Live page. So you can get all this information, lots of resources for you, including, and I know that Linda and Ken are going to talk about this, the leaflet for women to get more information about whether they should be getting vaccination or not, plus all the links to the RCM and the RCOG material. So really useful on there. So I'm going to move on to the main part of this program this evening, and that is we're looking at vaccination, the challenges, the information that's going out, and how our professional staff are dealing with that. And I'm so pleased we've got Dr. Ken Hodson.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.